Assalamu alaikum, the communication day. First scenario started with Mrs. Edith Gracely, aged 82 years. You are the doctor in the elderly ward. Mrs. Gracely, an elderly lady who suffered a stroke 3 years ago and has been predominantly bedbound since then. Apart from when her cares hoist her out into a chair during the daytime, she still has some verbal communication, but her higher cerebral function is slowly deteriorating, and she has been diagnosed with vascular dementia. In addition, she has a history of ischemic heart disease, diabetes, previous breast cancer, which was treated 20 years ago. She was admitted to the hospital 5 days ago with urinary tract infection and has been on intravenous fluid and and antibiotics since. She hasn't made much recovery, and the consultant feels it's appropriate to sign do not attempt resuscitation DNAR form for her. Please, your task is to sit with Mrs. Gracely's daughter, Mrs. Knowles, about the DNR decision, counseling, and address any other concern she may have. Let's start. Ready? Dr. Bill, Dr. Ibrahim?
Yes.
Here you go.
Hello.
Yes, hello, doctor.
My name is Dr. Ibrahim. I'm a doctor in the clinic today. And may I confirm I'm talking to Mrs. Knowles?
Yes, doctor.
And you are Mrs. Mrs. Gracely's daughter?
Yes, doctor. She's my mother.
May I confirm that you are next of kin of Mrs. Gracely?
Yes, doctor.
Mrs. Knowles, we are here today to discuss about your mother's condition. Is that okay for you?
It's okay, doctor.
Can you tell me, Mrs. Knowles, how much do you know about your mother's condition?
Yes, doctor. Actually, my mother got a stroke 3 years back, and most of the time she's bedbound. And I feel that his memory and her mood is a little changed. She cannot recognize us. And also recently she got she said some urine problem. So I want to know actually what about my mother's health condition now?
Mrs. Knowles, can you tell me what's your expectation about your mother's condition?
I think that you'll give some good treatment so I can go back with my mother to house.
I'm sorry for your mother is suffering, and I appreciate your feeling about your mother, Mrs. Knowles. As you said, your mother has a stroke since 30 years, and since when she was independent, and she was dependent, and her cognitive status was decreased. Nowadays, 5 days back, she got urinary tract infection. Do you know this urinary tract infection?
No, doctor.
This is some. You want me to explain to you this infection?
Yes, you can tell me.
Yes. Your mother has some sort of inflammation in her urinary system, in her kidneys and ureters, and we tried with her our best. We used the drugs, and we followed our guidelines. But unfortunately, your mother's condition did not improve. I'm sorry to tell you this news.
So why it's not improved? You're not giving proper antibiotic?
Actually, we are giving her proper antibiotic, but your mother has problems with her heart vessels, and she has a diabetes mellitus, and she had this stroke 3 years back, and this we call comorbidity interfere with our management for her, and we are doing our best, but unfortunately she is not becoming better, and I'm sorry.
I don't understand, doctor. This is old problem. What you say, these are old problem. Now I came here for my mother, mainly for urine infection. So what is the relation with that?
Okay, I appreciate your feeling about your mother, but these other conditions usually affect the ability of the person to resist the disease, and even with optimal treatment. I'm sorry to tell you, but we gave her our optimal treatment. But I'm sorry to tell you, we after we discussed her condition, we decided to put her on something called do not attempt to do resuscitation. Do you know this term?
What is this, doctor?
Okay, I'm sorry again about her about this condition and informing you this bad news. This is when we saw the patient is deteriorating, and he might deteriorate anytime and die. And we can't do any interference or doing what we call resuscitation. Do you know what's resuscitation?
But doctor, you are thinking my mother will die. You say die.
Um,
Why
uh,
you are thinking my
unfortunately,
mother will die?
unfortunately, I am sorry to tell you that your mother's condition is very critical, because she didn't respond to our treatment. And I appreciate your feeling, but uh, as I said to you, if your mother's condition deteriorate anymore and she died, we can't do any interference because of her condition. Are you following
Okay,
me?
so doctor, yes, I'm following it. So what we'll do?
We are trying our best by antibiotics, and these antibiotics try to fight the hair kidneys and urinary system infection. But we still didn't see any uh, remarked improvement for her. I'm sorry to tell you, we are doing our best, but she is now in a real danger of death anytime or deteriorating.
So now what is your plan, doctor?
Mm, our plan now to keep her on our management for UTI, and her full management. And we will keep trying to alleviate her symptoms if she feel any pain, or if she feel if any raised temperature for her. But uh, if the heart stopped, we cannot interfere with this condition.
This is, doctor, very much sadness for me that you will not interfere with my mother condition. It's really difficult to take this type of the news.
I appreciate your feeling again, and I'm sorry to tell you this bad news.
2 minutes left.
But I should tell you that we can't do something that we know that it will not help the patient and will just increase his suffering. That's why we try to not do this intervention. Are you following me?
Yes, doctor, I'm following you.
Okay. Can you tell me, Mrs. Knowles, who is living with your mother at home?
I'm living with my mother.
And are you financially supported? Do you need any help at home?
Yes, doctor, because you know that our income source will be limited. So I need some support.
I will talk to social worker and they will arrange help for you. And do you have any more concern, Ms. Knowles, you want to tell me about?
No, doctor, I'm really too much upset. I need to talk with my family. But I think, doctor, please, you can do that. What you said, you can try. If my mother with serious condition, please try for my mother for the best.
Uh, as I told you before, Mrs. Knowles, we can't do something. We know it might increase the suffering of our patient, the suffering of your mother, and it will not give us any benefit in our medical view. Are you following me?
Time is up.
Yes, doctor.
Anything, any concern more, Dr. Tandeep or Dr. Ibrahim?
No, it's okay. My concern
Okay, so let's
finished.
start. Yeah, let's start the comment. Well done, Dr. Ibrahim. Let's hear the comment, then I will comment.
Okay, just a minute. Okay, so first of all, I think that Dr. Ibrahim did well, but some point actually missed. I feel that some jargon Dr. Ibrahim used. First of all, that introduced he did well and identify, and he asked my concern, and I told about my mother's history, and he asked me about my expectation. He did well about these things. But some jargon he used that your mother's cognitive function reduce. So cognitive is one jargon. Then said some inflammation develop. Inflammation is another jargon. And we are giving for urine infection drugs. So better to tell medicine because drugs looks like you know that some narcotic agents, some hypnotic, narcotic, addictive agents. Better to use medicine. Then you said some vessel problem. So vessel is another jargon. It can tell that blood channel. And comorbidity, I feel comorbidity is another jargon. You can explain it after using that comorbidity, that multiple type of the disease. I think better to use multiple type of the disease. And another thing is you said without any warning, your mother may die soon. So I am actually not prepared to hear these things. So I think die that your mother, I'm sorry to tell you that your mother condition is not good and it anytime can worsen. I think better not to use die directly. You can make some preparation, mental preparation for me after that. And here actually the main thing is mother is stroke, bedbound, multiple type of the disease. I mean, highly comorbid disease, diabetic, muscular dementia, ischemic heart disease, bedbound, and now urine infection, and it's not improving. So actually need to explain firstly that her mother condition has multiple comorbidity and in multiple type of the disease and all our diseases, I'm sorry to say that all are in the worst condition, deteriorated in the condition. So after that, I think you need to ask that. So in this condition, actually, we tried to improve. I mean to treat the infection of the urine, but unfortunately, I'm sorry to say that it's not well responding. So our clinical team actually we did meeting and our clinical team analysis that actually your mother's condition really actually not good. I'm sorry to tell you. So this thing. So after that, need to explain about that resuscitation. Do not attend resuscitation. What is this? So that time need to tell that I'm sorry to tell that it's anytime. Unfortunately, your mother's heartbeat maybe if will stop. That time usually if anybody's heartbeat stop, usually that time in the who has minimum disease. I mean, when you explain about the comorbidities, after that you can use the comorbidity term. So actually, in that minimum well-fed person, we are doing pressing over the chest. We are giving a special tube, and we are giving even some electrical shock, and we are using some medicine by the blood channel. But I'm sorry to say that your mother is actually not fit for this condition. Are you with me? It's just you need to check that knowledge. So that time he can, doctor can tell, no, doctor, you can do this. So you need to explain, yes, I highly appreciate your concern, but it's actually our clinical decision and for the best interest of your mother. If you are trying to do this, it can cause harm. So you have to explain what is the resuscitation and why resuscitation issue came here and why you are not doing resuscitation for her mother. So here one issue can arise that my mother is older, that's why you don't want to do. So you have to explain this is actually not about the, I'm sorry to tell you that this is actually not about the age issue. This is actually general condition issue. So your mother actually, I'm sorry to tell that your mother is not fit for these things. If we are doing this, it will not actually beneficial. Moreover, it will cause injury to the lungs, bleeding, even rib can fracture. And even if you are trying to give artificial breathing, it can causes more infection. So the dignity and respectness will be not maintained for your mother. So you have to explain why you are not doing this. Do not attend resuscitation. Okay, so after that, you need to ask, but you have to ensure that. But I want to assure that we are giving all of other support, like we are regular monitoring your mother, we will maintain the nutrition, we will treat for the infection, we will maintain comfortable life, we will give painkiller medication if she feel pain, even she cannot sleep, we can give some sleeping medicine. I mean, you have to explain palliative care medicine and why you are not doing going for do not attempt resuscitation. And here, doctor can insist you, doctor, no, do this, do this. So that time you have to tell that actually this is for the best interest of the patient, and this is our clinical team decision. Yeah, so you have to explain this thing like she should not insist to do that. So after that, you asked me about that, who is living, anybody supporting. So here the most important thing as patient is going to die. So after that, when you make mental preparation, you can explain after that. Yes, I'm sorry to tell you that she may die soon. So when by making preparation after that, you can use die, but we need to use actually the set truth we have to use. And here, the important thing, social here, the most important thing, actually lasting power of attorney and advance wish. That is your mother nominated anybody that if she will see, anybody can take decision instead of her. And if there, she gave any wish that if she is deteriorated, how she will treat. So you need to ask these two issues. So after that, you can ask that, yes, what are the any other concern? I can give you some leaflet and brochure, and you have to give assurance that do not attend resuscitation does not mean that you are neglecting her mother. You are doing maintaining all other proper management, and at the same time, you have to tell that we will regularly reviewing your mother condition. If anything or decision change, we'll inform you. So you can give like something like this assurance. That's all my comment. Thank you.
Yes,
Okay, thank you.
perfect, Dr. Tanvir, as a comment. I think you explained the whole idea of the task in this scenario well. Regarding Dr. Ibrahim performance, for me, your approach very nice, Dr. Ibrahim. The introduction, the expectation, the confirmation of the next of kin, and the explanation why your mother here urinary tract infection, but try to avoid jargon as Dr. Tabir said. The inflammation different than infection. Inflammation, as I wrote in the chat box, inflammation means soreness, and it's something related to autoimmune or something from the body itself. But infection means something from outside, which is bug attacking this organ or attacking the body, and it lead to this infection. So there is difference between inflammation and infection. Take care of this. And the next point is, although you did great in the scheme of the scenario, the approach, in fact, you didn't explain the DNAR. You are trying to say it, but you didn't explain it. So let's
I think
make
the
it.
time
No.
wasn't enough.
Yeah, but even when you said it, I believe you did it as a breaking bad news. Perfect. You said, did you hear or have you ever heard about the NAR or the not attempt resuscitation? Don't bother about the name. Then you can explain it. What is it? You didn't explain. So you said,
I
do you know
explained
about?
a little bit, but I didn't go deep in the
Yeah,
compressions and intubation
but
and
this is the task. So you have to talk deep in this, right? Agree?
yeah.
Right? Yeah. So it's the task now. Talk about do not attempt resuscitation. Then you ask her, did you hear about resuscitation? She will tell you, yes, never ever, doctor. I don't know what's resuscitation. This is the perfect time to say it's a term for some patient in our hospital. In the best interest for them, we will not jump to do heart massage for them. The resuscitation mean if his heart or her heart stopped, we gonna do heart massage. In your mother condition, to maintain her dignity, we are taking care of this point and we are not preferring to do heart massage for her. Why, doctor? She needs no. I appreciate your feeling. I know it's so difficult for the sis to hear about that, but be sure that we are trying to help her not to suffer more. She suffered a lot because of infection, because of stroke, because of bedbound, because of ischemic heart disease. We are here to keep her calm and last days of her life to be sure about her fiction. It will not stop of course, the antibiotics. Someone wrote no palliative. No, this is the time of palliative because you will not do resuscitation, but you will continue other management. This is not end of life care. This is a patient with the not resuscitation, but she will receive everything else. Antibiotics, she will receive antibiotics. But in case of heart stop,
Also, it
we will
was his
not do.
concern because he asked me, "What's your plan of management now?"
Yes, it's
The
yeah,
question is that, sorry, the question is that
yeah,
palliative treatment, that means we'll start pain medications and these
yes,
things. But at the moment, this is not for palliation. She is not responding. She has UTI, not responding. Her comorbidities, while this patient is staying in the hospital because of her comorbidities and frailty, that's why we are doing DNAR for her.
yes,
So
perfect.
I will not start the palliative treatment. It's
No,
just a
doctor, this is
decision.
actually no, doctor, this is actually a wrong idea. I'm sorry to say.
I
We
don't
will
know.
not
This is
do.
what we are
No,
doing
no,
in our hospital here in the
no. This is
UK. This is
actually
what we are doing. So
okay. No, no.
DNR, any patient in the hospital, when any patient in the hospital, you need to know if this patient for resuscitation or no. Any patient enters the
Perfect.
hospital.
Yes, agreed. Yes,
Because of the heart frailty, because this patient is frail, she's hoist, and
yes.
so the frailty stage most probably over 4. That's
والله
why
شكلي
we
في
need to
برد
discuss the
عديد يا محمد.
DNR. That's why we need
المويه
to
برد
discuss the
المويه.
DNR with the
Sorry, Dr. Mayada, go ahead. Oh, sorry, I muted you, Dr. Mayada, by mistake. Sorry, Dr. Mayada, can you unmute yourself again? Because I thought the sound from you. Yeah.
So
Okay.
what will happen that we decide this patient, she's not for resuscitation. We need to explore. We need to ask the daughter about the wishes of the patient beforehand, because this lady have a stroke 3 years ago. So before she lost her capacity, anyone discuss with her or explore her wishes when we arrive to this stage when she can't stand for herself to give a decision about resuscitation. If she has any wishes before, this is what we will ask the daughter about. And if and if the patient had wishes like this that she need not to resuscitate or anything, then we go further for that. At the moment, we will discuss with the daughter that this decision, because for the best of interest for this lady, as her comorbidities, even if anything happened, because of her comorbidity, she will not benefit from resuscitation, that by trying to restart her heart if the heartbeat is stopped.
Perfect.
We will continue treating her normally. Even now, she is not responding. It is UTI. She is not good responding to the antibiotic at the moment, but we will change. We'll do culture and everything. We'll continue treating her normally for her infection and everything. But the only thing that we didn't attempt at that moment when her heart is stopped. But now she's in active treatment. Understand? This is not palliation. This is not palliative treatment.
No, Dr. Mayada, you have to know the difference.
I wanted to ask one question, sorry.
Yeah.
I take this scenario with one mentor before, and he told at that time, the same scenario, patient had UTI and not responding to multiple antibiotics and even after culture. So the two topics here for us is to palliative care, and the definition of palliative care is to withdraw all active medication. I told him no need
this is
to
end
stop.
of life, yeah? This is EOL.
Yeah, this is end of
This
life.
is end of life. So if she's not responding and she starts to deteriorate further, that this is EOL. This is end of life care. So this is patient at the moment. Sorry? At the moment, I'm talking about this patient that in the scenario, according to the scenario can be changed like small. If they change this scenario small, like this patient is not responding and she's deteriorating, it will be EOL scenario. But in this scenario specifically, this patient hoist and everything, she has UTI. She admitted for 5 days. She's not well recovered. She's not well recovered, but she's not dying. They didn't say she's dying. She's not responding, that's it. She's not actively dying. That's why she's not for EUL at the moment. And
I agree.
she's not for palliation yet. We are still treating her.
My question, sorry, my
So this is
question
not
to you.
palliative.
The
This
end
is
of life
DNR.
care means withdrawal of all active.
Yeah, this is exactly. This is So this is not the case of AOL. Yeah.
So
this is not a case of AOL.
So we should withdraw antibiotics also for UTI.
Even antibiotics,
if the scenario,
everything.
yes. Perfect. But this is not AOL at all. This is, for me, I believe,
this is DNR. DNR
with continue management accordingly without resuscitation. So it's considered as palliative, even if you will not mention palliation or palliative therapy in brackets, but you can say, because she will raise this point, Dr. Mayada, be sure
if she
will
raise
ask
it,
you.
if she raise it, and
even
then
from
we
our
say,
side.
if she raise it, that if my mother is not responding, what is the next step?
What you will do? What's your plan? Yeah, you have to
step will be
explain.
palliation.
Perfect.
Next step.
Yes.
But now, at the moment, she's just 5 days in the hospital. She's just 5 days in the hospital, and she's not responding to antibiotic. We are not palliating her yet.
Okay, Dr.
Do you
Mayada,
understand
you agree?
my point?
Yes,
Maybe
I
I'm not clear
understood.
enough.
No, it's clear. You want to say, this is the time for DNR only. No need to mention palliative. Okay, I agree as a task. Okay, as a task.
With the task,
Perfect. If there is time and she asked you, doctor, do you think mom will die and you will not continue managing or caring here? What you will say?
At that time, yes. At that time.
So it's again, you agree to do.
Yeah. If the patient asks, this is the future plan. At the moment, we are
Yes,
treating her. We
yes,
follow her day by day. If she's not responding, if her condition is deteriorating, our plan
perfect,
and our priority is to keep her comfortable. And to keep her
perfect.
comfortable, we is still treating her with normally
Medication,
with medication to
antibiotic.
help
Yeah,
her to be calm, and we may need
perfect.
to stop the antibiotic at that time if it is if
No, no,
we
no. Why I will stop the
that
antibiotics?
this is I'm talking if she asked about the future of if
Even the
it's not
future,
going.
if the
Uh,
task is not end of life care, I
but
will
for this
continue antibiotics.
for this task, for me, I will just be for
Okay,
DNR.
I agree.
I will keep
Agree.
DNR scenario only. I will
The
not.
main task.
Yes, the main fact. I will not say anything about palliation at all.
Okay. Thank you, Dr. Mayada.
No.
Very nice comment. And again, we are clarifying the things. You and me and Dr. Tanvir agree about the concept of management in the future will be palliation. If the topic was raised or if the hidden agenda raised by the surrogate, okay? So again, we are agree for, and all of us agree for this. But the main task, of course, we have to talk about DNAR
Yeah, no.
initially. Then, if I have time, and or if she raised the point of doctor, what you will do with my mother? What is your plan with my mother? What's your team plan for my mother? This is the time to say we are trying to be sure that she is calm, she is comfortable, she is taking her medication appropriately, everything ongoing, the feeding. But I will not stop anything. By the way, this is not end of life scenario, so I will continue. Although I put here DNR, but I am caring the patient. Okay, so we have to know this is the difference between end of life care and management as DNR or with or without palliative. But I believe any DNR patient should continue the management plan and consider as palliative. Even you will not mention the word palliative. You can say everything about palliative in details, but don't say palliative because it's not written in the scenario. Okay, as Dr. Mayada
Dr.
already
Basim, I have a comment,
discussed.
please.
Yeah, yeah.
See, just think practically. If
Yes,
our relatives, just think about ourselves. If any of our
yes.
relatives going to the hospital and doctor
Okay.
explained that we will not do chest compression like that. So what
Yes.
is our concern? Our first concern that is doctor, you will keep her letting die. Obviously, we will ask that these things.
Yes, yes, I
So
agree.
when we tell that do not attempt resuscitation, even if
Yes.
treated palliative, only not treated, you have to assure that we will not do that chest compression, air pipe and tube and medicine, and you need to explain why you are not doing. At the same time,
Yes.
you have to explain that it does not mean we are keeping her letting die. We
Yes.
will do
Perfect.
mental support. We will do other things like if there we will try to maintain the nutrition. If comfortable life, I mean, ultimately we have to counsel the palliative. If you not tell this, it means you will do nothing. You will just waiting to keep her dying. So you
Okay.
have to
So,
explain. It's not a matter
yeah,
of mentioned or not mentioned. This is simple
perfect.
thing that what you will do
Yeah. So
there.
let's take home message from this scenario. Whenever you have DNAR clear task scenario, talk about the DNR and you may or you may not raise the point of palliative according to your time. The opposite scenario, if you have palliative therapy, will you raise the DNR if not written in the scenario?
You
This is an
must. You must raise. If you must raise the DNR because
no,
the
no, it's
patient
not must, Dr.
You
Mayada, sorry.
shouldn't.
if the
You know, no,
patient
it's
if
not
you
must.
palliate the patient
Yes,
must
but
have DNR.
no, 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 Dr. Mayada, it will not be must, okay? Let's talk in real patient. If you have cancer patient and he might survive for months or years, he
Yeah,
might be, yeah, he might
you
be,
want to
and he
treat him
might not
or
be.
you will he will have chemotherapy and everything or no?
Yeah, they will do everything, chemo, radiation. There is palliative
Okay,
chemo.
you are
There
right. In
is,
this case,
yeah,
if the
yeah.
patient will actively
So,
treat it, That
Yeah.
means he will have chemotherapy, radiotherapy. This is not DNR case.
But this is palliative also, by the way. This is palliative. Palliative chemo, palliative radio, even palliative surgery. They can do removal of some masses if there is effect or compression. So it's a matter of either DNR written in the scenario or not. But let's make it again the take-home message. If you have DNR, you will raise the point of palliative along with the DNR. The opposite, if you have palliative, it's not necessary to talk about DNR. This is the take-home message, okay? Agree for all of us for this? In another scenario, if you have end-of-life care, definitely you have to mention do not resuscitate because the patient will die after seconds or hours or minutes or whatsoever. You have to specify the DNR because he will be dying after a couple of hours or minutes. So you can say fastly, we will not resuscitate or will not do heart massage for your mother because it might happen. Why? You have to be honest. The patient will die after, according to the scenario. By the way, they are writing in the scenario how duration he might live. So it might be 6 hours, 6 minutes, a couple of minutes, and you have to be clear with the patient or surrogate about his dying father. If they wrote for you the day the patient expected to die after hours, you have to say to the surrogate, I'm so sorry to say he might die within hours or minutes. And you can invite someone and blah, blah, blah. This is for end of life care. For the palliative, it's not necessary because he might live longer, up to years. But if you have the DNR patient, you have to talk about palliative, okay, to maintain the dignity. But still, we are giving care because the first question by the surrogate, will you continue care of my father or my mother?
Sorry,
You have to mention.
because I just confused now. Sorry.
Yes, okay. Say, Dr. Lamida, what do you want to ask?
My confusion about maybe I'm using different word, I don't know.
Yeah.
But for not any patient with DNAR must have palliation. This is not true. This is not the fact. A patient can have a DNR because of that moment. When we put the DNR, because of that moment, we will not jump to the chest. But he will have active treatment. I mean, active treatment, that's
Yes.
antibiotic, everything.
Yes, he will. Yes,
He will be
everything.
treated
Yes.
like everyone. But if
Yes.
that happen, we will not give anything.
Yes.
So why we are palliating him? Why we are giving palliation here?
What the meaning of palliation? Even the
Actually, not a
antibiotics
matter
are
of
palliative.
palliation. This is support. This is support that you will maintain, or
Yes.
you are giving support. This is not like traditional palliation, like in the stage of the cancer.
Yeah.
This is not actually, Dr. Maida, not like that. It means that you are giving her support. This is the assurance that you are assured that
We'll give her
yes,
all
we are
normal
beside.
treatment,
Yes, it's
antibiotic
not
if
that
she
the
needs.
traditional
Assalamu
Don't
alaikum.
palliation.
Yeah, don't stick to the word, alaykum salam. Don't stick to the word
Because
palliation.
palliation, we have a
No, no.
palliative treatment.
No,
We
it's a
have
support, doctor. It's a support. Don't
Yeah,
take it as a
it's
palliation like in the
It's
stage of the last disease, cancer
okay.
patient, metastasis.
No,
Not
but
like that.
May I comment?
yes, Dr. Ibrahim.
If he didn't ask me about my plan of management,
Yeah.
I shouldn't say any palliative treatment in the DNR. That's why I read. Okay, but when he asked me, the examiner expected to deal with a clinician. You should say your plan of management. Whatever your plan is, it palliative treatment? Are you going, as I said, to continue your trial to fight the UTI? It's not a problem. But if he didn't ask me, I shouldn't talk about palliative treatment because I was asked to talk about DNR. That's the conclusion, I think. Yes?
Yes, I agree also with this. So let's say I will not say palliative because the palliative itself means you will continue caring, right?
because
Palliative
there is
means
a treatment for when you say palliation, this is there is a group of treatment.
it's
This is
yes, it's
anticipatory medication. So not any patient have DNR must be having anticipatory medication.
but most of them they will have this medication. Palliative mean you are
No.
supporting. You are
Not,
supporting the patient
not the case. It's not the
till,
case at
till
all.
the end. So what you mean by palliative? What you mean by palliative?
Palliation, I will not mention it at all for
Yes,
DNAR.
I will not mention the word itself, but I will explain the things included in the palliative, which is medication, support, if he need oxygen, everything will be given to the patient as a care. Okay, but
The name
in
here is
case,
active treatment,
okay, I
not
agree.
palliation.
You
Active
okay? I
treatment.
agree. Don't mention the palliative as a word
Yeah, because
because
palliative, this is different medications. This group of medication, we stop everything and we'll put this medication for the patient, or even this palliative palliative treatment that you give morphine, you give a lot of medication, set of medication prescribed for the
according
patient.
palliative according to the patient need, Dr. Mayada. So if the patient need painkiller, I will give painkiller, even he is not cancer. If this patient with urinary tract has pain, I will give her morphine. Okay, let's make a deal again to cut this story short. If you have palliative in the task, talk about palliative by the name, palliative. If you don't have, do the support, all the support the patient needs, okay, without mentioning palliative. Clear or agree now, Dr. Mayada, because you have only objection for the word palliative. So we'll not say we will palliative your mother. No, we will support your mother.
Yeah,
I
yeah,
agree with
support,
Dr. Tanvir.
support.
Yeah, we will support
Nice.
your mother without mentioning word palliative because some doctors, as I read a very nice comment here, it's palliative care is interdisciplinary medical approach that focus on optimizing quality of life and mitigating suffering for individual with serious, complex, and often terminal illness, providing comfort, support, and symptom management. So it means I will support the patient according to his needs. And this is what we are doing, even in case of DNAR. If you are having objection about the word palliative, let's say it in another word. We will support your mother. We will give her according to her need to maintain the dignity and the care she needs. Even the medication, the feeding, everything will be provided apart from the heart massage. Agree now?
Yeah.
Okay, thank you.
Yes, I get
Yeah.
Yeah, Dr. Mahdi. Dr. Rashid, yes.
both of you are right. يعني زي ما بقول الفقهاء لا مشاحة في الاصطلاح. I don't know English. لا مشاحة في الاصطلاح. يعني based on مثلا now DNR and already on palliative care, you can continue palliative care, okay? For مثلا
Yes.
cancer, for any reason, he was on palliative before this DNR, and we will continue. DNR will not
Exactly.
stop the palliative care.
Perfect.
And
Yes.
our patient now not palliative, he is taking antibiotic regularly. We can continue antibiotic.
Perfect.
ايوه مثلا for example patient needs ventilation, anything, any kind of treatment, we can continue palliative or other than palliative also.
Perfect. And this is different from EOL, end of life care. We will withdraw. Even the medication, we will stop it. Okay, this is a big difference
I'd like
between
to
end
hear
of
more
life.
about end of life care. معلش كلمتين كده.
Yeah, end of life care, if the patient on even antibiotics, you can stop the antibiotics. If the patient on medication for any other medication like supported vitamins, you can stop all this medication. If the patient on ventilator, you can withdraw the ventilator. Even the patient on vasopressor support, you can also withdraw the vasopressor support. This is the difference. But in palliative, if the patient needs some medication for the support of circulation, you can continue it. Okay?
So
See,
in end of life,
Dr.
you will not
Basil,
give anything.
Sorry, Dr. Rashid?
On end of life, you will not give anything for the patient.
Yes, only IV fluid and painkillers. That's it. You are letting the patient die in seconds. Literally, the patient will die after, for example, if he's on vasopressor support, you will turn off the vasopressor support. Within minutes or hours maximum, he will die or she will die. This is the difference. But palliative, no, you will continue support till the end. But if he has cardiac arrest, you will never do massage. Clear now?
So you will give only IV fluid and what? Painkiller?
Oxygen, IV fluid, painkiller.
You will continue on end of life care, huh?
Yeah, this is
Oxygen.
the end of life care. Oxygen, Low oxygen, by the way, it's not intubation and ventilation. No, only sometimes they are putting face
Mask
mask.
or nasal fan.
Or exactly
Yes.
something just to if he needs oxygen, just to give him. Okay, not to die suffocated, but definitely
Fluid and
even
analgesia.
fluids. Exactly. This is the three important elements for end of life care you have to maintain. Some doctors will ask you if he asks for feeding, can you give? The answer is if he is able to swallow, we can give him according to his needs. There is some wishes from patient if he have some capacity to ask for food, yeah, we can give him food. Although it might harm him, it might lead to infection, aspiration. But if he needs, we can, if he's able to swallow, we can give him. Apart from this, IV fluid is the only choice. This is and practical in the exam. The doctors who mention feeding, NGT feeding, they cut the mark. The doctor who mention other feeding way, they cut the mark. The only way is IV fluid. Okay, this is happened with me.
Patient with mechanical ventilation, we can remove also mechanical ventilation.
Yes, sometimes if the task is to withdraw the ventilator, you can withdraw the ventilator. Okay, so according to the task, if withdraw the ventilator, you will withdraw. Like brain death patients, they are writing clearly withdraw of the ventilation. Okay, just follow the scenario and it will be clear. But you can withdraw anything except IV fluid, oxygen, and painkiller. Clear now?
Okay.
Yes, clear, Dr. Muslim. Yes. Thank you.
Yes, must be.
We can move to the next scenario,
Yes,
Dr.
yes,
Wasim.
sure, yes. Your scenario, Dr. Tanvir, palliative,
Okay, please
sorry.
let patient name and
Yeah,
like
patient
patient name and
relatives.
the son name.
Okay, patient relatives. Second scenario. Patient relatives arrived to be told that their father was unfortunately dead on arrival to the hospital. It is likely he suffered a large myocardial function. Break this bad news to them and guide them with regard to the need for a coroner's post-mortem. For religious reason, they would like the body released today. Okay, Mr. As usual, Mr. John Smith, you will sit with his son Adam. I will write the patient John Smith and the son.
Mr. John, like 80 years. Mr. John, like 80 years
Yeah,
or
and the
70
son
years.
is Adam. 6 years, like he's a little young because
Okay, 60
unexpected death.
years.
Son Adam, okay?
Son Adam. So John's
Adam.
son Adam, how?
Yeah, make it easy. I prefer these names to make it easy.
No, one Christian name, another is the Muslim name. That's why. Okay, we can start.
Yeah, perfect. Here you go.
Okay, can you start the timer?
Yes, started.
You start timer?
Yes, I started already. You can start now.
Okay. Hello, sir. I am Dr. Ali, one of the doctor in the clinic today. Can I confirm you are Mr. Adam, son of Mr. John, 60 years?
Yes, Dr. Ali, I'm Adam.
Mr. Adam, now I came here to discuss regarding your father's condition. Is it okay for you?
What happened for my father? Okay.
Okay, Mr. Adam, before that, I want to know that are you next to the kin of your father?
Yes, I'm next friend of him.
Okay. So, Mr. Adam, how much you know about your father's condition?
I don't know. They told me that my father sent to the emergency and
Mhm.
I left my work and I came
Mhm.
uh, uh, as fast as possible and they told me to
Mhm.
wait because you want to talk to me.
Mhm. Mhm. I appreciate your concern, Mr. Adam. So, what's your expectation from our meeting today, please?
I don't know. I heard my
Mhm.
father has chest
Mhm.
pain and he lost
Mhm.
conscious. and he was
Mhm.
sent by ambulance. I don't know what's the
Mhm.
problem.
Yes, I highly appreciate your concern, Mr. Adam. Actually, as you know that your father developed chest pain, and I'm sorry to tell you that your father came here actually the much worsening condition. I mean, when he came, actually, we already checked all the sign of the life, and I'm sorry to say that we actually not properly getting the sign of life. Are you with me?
What, doctor?
Actually, when is your father came here, he came here with much suffering, and as you know, the severe chest pain, much chest pain, and we immediately assessed, we immediately started our emergency treatment, we immediately started our chest compression, oxygenation, special medication, and I'm sorry to say that when we assessed him, we don't find the sign of the life with him.
Oh, you mean that he died?
I am afraid to tell you that your father is now no more.
Why you didn't treat him?
Yes, I'm appreciating your concern. As I said you that when your father came with much worse condition, and that time we immediately assessed and we immediately did call our all of the specialty department who are dealing this special situation, and we did all of the major life support therapy. I mean, we give chest compression, we started oxygenation, we give a special medication, and we introduced reactive. What we are doing in that type of the situation, but actually, I'm sorry to tell you that your father came too much worse condition, and our maximum treatment failed to save
Oh
him.
my God, you left him to die?
No, I'm sorry to tell you that it's not at all. We are doing our best to save his life. And as you know that your father, as I informed you, your father came here with much worse condition. And despite our maximum treatment, actually, he did not survive. Are you with me?
And what should I say now to my family?
I understand this is really a very difficult situation for you, for your family. Can you take some rest and I will give you some tissue and water. Can you take some water and tissue? After that, we can start.
Thank you. Thank you.
Okay, so as Mr. Adam, you know that your father has chest pain. So in that type of the chest pain, like we are thinking this is one condition we are calling about the myocardial infarction. Do you have any idea about it?
Yes, I have some idea.
Can you share with me?
Heart attack, you mean?
Yes, I highly appreciate your concern. Yes. So from our assessment, we primarily thinking that it's probably that heart attack. I mean, the blood channel of the heart became blocked and lost the heart function and later lost his brain and breathing function. But I want to tell you that is actually not sure. We need some analysis, and for this analysis for confirmation, we need to do. We need to involve a officer. We are calling is postmortem officer or coroner postmortem. Do you have any idea about it?
Why officer?
Yes, I highly appreciate your concern. Actually, as you know that we are suspecting your father as getting heart attack, but actually in this present condition, we are not sure. So in that situation, there is an independent officer we are calling is coroner postmortem. He is much experienced about these things to identify and to investigate actually what is the cause of this death. So in this situation, actually, that we need to keep your father and our postmortem officer. He will see maybe he will take some snip from your father's body to identify
No,
the
you can't,
disease.
doctor. You can't. This is
Can I know
prohibited.
that?
in our religion.
And yes, I highly appreciate and I have full respect to your religion. But as I say, that actually in that type of the things, we need to actually that give the death certificate. But if we don't know that what is the reason of death, so it will be difficult to issue death certificate unless we investigate this issue. Are you with me?
But you said he has heart attack.
No, I said you actually that we are thinking it's probable, but it's not sure. For confirmation, we need to do this test. I mean, but I want to tell you that we will maintain the proper dignity of your father. We will do maybe need very small incision, which will not identify, not seen by you, and very will make proper cleaning. And after proper cleaning, they take very small snip and we'll make it closer very nicely. So the dignity and respect, it will be fully maintained for your father. Are you with me?
But we have in our religious concept that is the dignity to take the body as early as possible to bury him.
Yes, I highly appreciate your concern. In that condition, we can involve a chaplain nurse or religious or spiritual person. So even with your family member, we can involve and we can talk regarding that decision. But what I want to mean, actually, this is for the best interest of your father to know, to analyze that what is actually actual cause of the death. Are you with me?
Okay.
And I
Two
want to
minutes
assure
left.
you, 10 minutes or
2 minutes left. 2 minutes left.
2 minutes, 2 minutes. And I want to assure you that we will release the body as early as possible. Are you getting my point?
Okay.
I just want to know some other social history, if you don't mind, with whom your father is living.
Only with me.
Anybody dependent over your father?
No one. I was helping him.
Okay. So I will give you some leaflet and brochure. You can read it more about that corona postmortem, so you will get the idea. Even I will give our contact number, so you can ask anytime, talk with us. Is it okay for you?
Okay.
Do you have any more concern?
How much time it will take this coroner?
Actually, we will try our best to release the body as early as possible. But actually, it depends upon our coroner officer's investigation, and it depends upon his decision. But we will try our best to release it as early as possible.
Okay, doctor.
Do you have any other more concern?
No, doctor.
I am really sorry, and on behalf of our team, take my full apology. I will take my full condolences for your father, and it's really hard time. I understand, but hopefully that if you need any meeting with your family members, you can come with us. Is it okay for you?
Okay, doctor.
Okay, time is up.
Thank you. Thank you.
Well done, Dr. Tarjeeb. Let's hear Dr. Ibrahim comment, then I will comment.
Okay. He did very well, but the important point, and always we go on this point, he didn't read good that the patient arrived death. He shouldn't say he was in a critical condition. He arrived death in the
Yeah,
written in the scenario.
yes.
And this is very important because you might destroy a large part of your station because you didn't read, but you did very well, and you was going in step by step. I think you didn't concentrate on sympathy and empathy very nice, but you did very well. But you should hear that dead on arrival. This is the main problem here.
Yes.
He was dead on arrival.
Yes. Okay. Any other comment, Dr. Ibrahim?
I think this and about the sympathy and empathy, I think he didn't concentrate much about this. That's why
Yeah,
I gave him time, and at the end started to say yes, yes, yes. I want him to finish something, and he
yeah,
Okay,
and he
one point I just
provide.
want to tell
Yeah.
you
Mhm.
that I mentioned here that when your father arrived, I'm sorry to tell you, we don't found any sign of the life. That so I actually cleared here that
Yeah, but you
I'm
said
not
it
using
also.
directly not use the dead because I feel this is little difficult term. So I said that we don't found any sign of the life, but even not found the sign of the life, we did our best uh, because patient asked, the son asked, so what you did that in front of you, he died. So that's why I told actually we did, even we don't found the sign of life, we did our best try to reverse it. But even that is also failed. I don't know
Yeah.
that this approach is okay or not.
might be I
Okay.
didn't hear it. Yeah,
No, but you mentioned both. So there is doubt now. You said critical and you said no life. So be
that's why
clear
I
from
hear.
the
Yes,
start. Yeah, to be clear from the start, he arrived dead, and what we should do, he's already dead. And be clear, honest, with sympathy and empathy, of course. It's a breaking bad news, clear scenario of breaking bad news. I don't have good news today for you about your father. Your father arrived to us dead. I'm so sorry to say that. Then let him react whatever he will do. You should say it at once after golden silence and warning shot. Okay, so it will be followed by golden silence and it will be preceded by a warning shot. It's breaking bad news, clear scenario. Whatever he will do after that, let him react. I'm so sorry for your loss. Take some water, take some tissue. My condolences. Do you need anyone to attend the meeting with you, to support you? Anyone with you can help you? And go to the next task, which is coroner. I have some point here also to clarify, Dr. Tanvir, about coroner. But before that, you said myocardial infarction, and he corrected you. Supposed to say, to be the opposite. You will say patient, your father came in heart attack. Then you will say it in other explanation. But you said
yeah.
he came in myocardial infarction, and he said to you, you mean heart attack. He's so clever, surrogate. Supposed to say he came in heart attack, okay? Take care of jargon. Or you can say initially it's a condition called myocardial infarction, and in our term it's myocardial infarction, but in your term it's called heart attack. But don't say myocardial infarction without giving the simple explanation for it. Let's go to the next thing, the corona. You said many times we will do as soon as possible. In fact, the coroner will be the one managing the time. We don't have any control on them, although we will try our best, but it's there. And you corrected that in the end. You mentioned at the end, you told him it's a matter of coroner. You can say even we are legally bounded to this. We cannot do anything. We cannot interfere with them. If he said no, I can't, I'm so sorry. It's something related to our law, and they will do it without any option. If he insists, okay. Our religious, we respect your religious, of course, and we appreciate your family issues. But even us, we don't have a choice. Okay. This incision only try to make it as cuts. They will do some small cuts in his body without disfigurement of the body. So we will be sure and we will try our best to take your body, your father body, without any disfigurement to maintain the dignity. Okay? Again, at the end, you can provide support, and condolences for till the end.
And another point,
Yes, Dr. Ibrahim.
and DNR, is it right to say I'm going to give you brochures and leaflets?
Yeah. Anything you can provide, brochure, leaflet, and website. You
Yeah,
can even, check in the website about DNR, about palliative, anything he will have some queries about it, let him read about it. So you will
yes,
explain some of them, but to be more aware about our task today or about our point today, please read, and this is the leaflet show website to read about this topic more and to know more details about it. So it's clear now. By the
Yes.
way, any closure you can provide leaflet brochure. Even in this scenario, as Dr. Tanvir did, I'm sorry, blah, 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 then they will provide you some details, leaflet brochures about coroners. Just read about them to know more. And any inquiries, please contact us. Any closure of any scenario, you can do it. Counseling disease, counseling about medication, breaking bad news, or DNR, palliative, medical error, complication of medication. Any scenario, you can close your scenario and the station by offering leaflet brochures and websites. Okay. Any other question, Dr. Ibrahim?
Thank you.
Well done, Dr. Tanvir. Any question? You know, for Dr. Ibrahim and Dr. Tanvir, this type of practice make you more confidence. I believe if you do a scenario one day with some colleague, if the scenario will come to the exam, you will remember this day. Because I believe also the cocktail of the cases and the scenarios, you will receive different cases from other colleagues. For example, Dr. Ibrahim, I think first time to practice Dr. Tanvir, he gave him a scenario. He will remember Dr. Tanvir with this scenario, and Dr. Tanvir will remember Dr. Ibrahim with this scenario if he faces it in the exam. That's why, again, I'm encouraging everyone to practice. It will never be useless. You will get and you will gain a lot of benefit whenever you practice and with whosoever you practice. Okay.
Yes.
Any question, Dr. Tanvir? Okay. Any comments from others?
No, thank you, thank you. Actually,
Most
I
welcome.
faced this type of the case.
Yeah.
This type of the case I faced lots of time I'm facing in my duty
Yeah.
time.
By
Like
yeah
even
by
yes, yes, yes. Even you know that like I think maybe 1 month back, suddenly dead young lady with
yes
history of the renal failure. History of the renal failure, young lady suddenly died. So even they cannot believe this young lady how suddenly died. So he came at the broad death. So same scenario, like this scenario, same scenario,
yeah
but that is not
it's
involved postmortem. The difference is like that, only
yes
postmortem
yes
is not involved. Otherwise,
but the
everything
way
same.
yeah the way how to express and to
Yes,
deliver the bad
exactly.
news, you will really learn a lot from these sessions. I mean, even the practice will make you more confident when you are talking to relative to break bad news. The way to break bad news, the warning shot, the golden silence. We are practicing every day like these scenarios in our practical life, and we can do it in a professional way compared to previously. Okay. Thank you, Dr. Amir. Dr. Mohi asked why corona already cause of death is known. Yeah, he had heart attack, but he came dead, and we don't know why he had heart attack. Even it is MI, we have to know, is it something criminal, something he took, medication, something related to uh, policy wise. So it's still questionable why this patient arrived to emergency dead. Suppose he will come with the manifestation, okay, but even if he come with manifestation within and he died within 24 hours, we can do this post-mortem. Another indication, unexpected death on admission, less than 48 hours. And the death on table, this is another indication for post-mortem coroners. You have to know this indication, Dr. Mahi, okay? Either they will write for you as a clear task or it will be hidden agenda, but you have to raise it. This is the indication. Explain to the patient what is the coroner. Yeah, it's an office assigned to check and to analyze why and what the cause of sudden death in your father. We are here to help you to reach and to find out what the possible cause. And it's again something not optional. They will do it by law. This is the difference between postmortem clinical investigation or examination and the coroner. The coroner, no consent. They will do it like by force, but we are not saying by force. Okay, no one say it by force, but it's like by force. And the post-mortem clinical examination will be by consent from the family. If they refuse, this is their choice, and we can abort the process itself. But the coroner, it will be done by anyway. Dr. Rashid, sometimes they are doing only blood test and imaging. So according to them, this is not our choice. They will decide and they will do the best interest for the I receive a call. If cutting is necessary, they will avoid forehead and it will be very small one and will be closed in good way. Okay, so don't go deep in this details. Just say small cuts. They will not disfigure the whole body shape. CPR should be mentioned or not? Why CPR? You don't know. Details don't say something which is not written. Maybe he's dead already, and of course they will not do CPR. But if they do, if they wrote in the scenario, CPR done for 50 minutes or for 1 hour or even 24 hours, say it clearly. Okay? So stick to the scenario. Don't say anything which is not written. If the CPR written, do CPR. Say CPR. If not, ignore it. You don't know what happened. So assume that he arrived as dead, and that's it. The task now is to break bad news. I don't care about the details of the arrival or what that happened already and what they did. This is not our task here. I think, Dr. Ibrahim, I think he can offer a company in this scenario. Yes, of course, definitely. Even before starting, you can invite someone or you can tell him you need someone to attend the meeting with you. Why? Yes, he might support you. You might need his support like this. This is one of the must in such scenario or end of life care scenario. Please, you have to invite someone. End of life care and like this corona or post-mortem or sudden death or something will be shocking. Okay. Thank you, Dr. Ibrahim, for this thought. Any question or comment else? Okay, we might have a session tomorrow, and it might be the last session before Eid. I will try to do another communication after tomorrow, but definitely tomorrow maybe the last session for non-clinical, and we'll get some vacation for Eid and the last Ramadan days, just to pray and to do some prayers in the last 10 days. After Eid, I will announce when to resume the sessions, okay? But inshallah, tomorrow we'll do some one more long clinical consultation. Thank you everyone for the attendance. Thank you, Dr. Ibrahim, Dr. Tanvir.
Thank you.
Yeah. See you tomorrow, inshallah, with clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.